In a big trial, chewing sugar-free gum lowered the number of premature deliveries. In a big research in Malawi, chewing sugar-free gum every day lowered the number of premature deliveries. Past study linked poor oral health to preterm birth motivated the oral intervention. Instead of conventional sugar, the gum contained xylitol, a substance that can improve oral health. Researchers reported at the Society for Maternal Fetal Medicine's annual pregnancy meeting on February 3 that 549 out of 4,349 pregnancies, or 12.6%, were preterm among women who chewed xylitol gum. When compared to the group who did not receive the gum, this is a reduction of 24%. 878 of the 5,321 pregnancies, or 16.5% of the newborns, were delivered before 37 weeks. Gum users' oral health also improved. Approximately 4,000 women underwent a dental exam and a follow-up checkup. When compared to women who did not chew the gum, those who did had less periodontal disease, a condition in which the tissue surrounding the teeth becomes infected and inflamed. Kim Bogus, a maternal-fetal medicine specialist at the University of North Carolina School of Medicine in Chapel Hill who was not involved with the study, says, "The findings are really positive. The researchers are using a low-tech, easily adaptable intervention to a very difficult problem in a low-resource setting." She says additional research is needed to discover if this could work in other situations. Researchers recruited 10,000 women from 8 health clinics in Malawi's greater Lilongwe area before they became pregnant or were in the early stages of pregnancy for the new study. Community health workers provided individualized information on pregnancy, preventing preterm birth, and improving dental health to all of the women. Approximately half of the women were also given gum. The research was conducted as part of a 10-year experiment in the Lilongwe region, which has a preterm birth rate of 19.3%, one of the highest in the world. First, the study team spoke with people of the community to learn about the issues around pregnancy that they were concerned about and wanted to address. Preterm birth is referred to as Kuchila Masika a Sanquane in the Chichewa language of Malawi, which means born too soon. All participants knew of many women who had suffered born too soon, says Shersti Agard, a maternal-fetal medicine expert at Baylor College of Medicine and Texas Children's Hospital in Houston, who was part of the project's early focus groups. Prematurely born babies might suffer difficulties that affect their lungs, neurodevelopment, and other aspects of their development, posing long-term health risks, and they are more likely to die in their first year of life than kids born full-term. Researchers analyzed the rate of cavities and gum disease among pregnant and postpartum women, which was in the 70% range, in addition to learning about the community's attitudes about premature birth. They also inquired if eating xylitol gum was something that would be appealing, both actually palatable and acceptable, according to Agard. Periodontal disease and premature birth have been linked in studies for several decades. Atherosclerosis and other illnesses have been linked to the inflammatory condition, SN, April 6, 2016. The mouth's microbial population is second only to the gut in terms of diversity and size. Periodontal disease causes a shift in the oral microbial ecology, allowing bacteria that cause inflammation and gum tissue destruction to flourish. The bacteria could then enter the bloodstream and travel to other organs, including the placenta. Chewing xylitol gum appears to keep the transition in the oral microbial ecology under control. Previous research has found that chewing xylitol gum reduces cavities and may also reduce inflammation. More research on what is going on at the microbiological level is planned by Agard and her colleagues in order to better understand how better dental health reduces preterm birth. In the study, the team also wishes to track the neurodevelopment of children who were born early and those who were delivered on time. "We still want to make sure you are making a difference in somebody's life, regardless of how cost-effective an intervention is," Agard says, and the end consequence is how do those youngsters do.